Hi, welcome back to 10 Minutes With. Today I'm joined by Adéla and we're going to be talking about what it's like to be a young patient advocate in today's rare disease field. Welcome Adéla, thanks for joining me.
Thank you very much.
So if you don't mind, I'd like to start way back at the beginning. How did your rare disease journey begin and how did you first get into patient advocacy?
So if I go until the very beginning, I grew up and I spent a lot of time with my friend who had SMA, spinal muscular atrophy. And so we grew up together. Unfortunately, he passed away like 8 years ago now. And so I saw the challenges that he was facing. And I had many other friends with rare diseases. And, I saw how the social system isn't working, how the social help isn't coming. And I think that's why I got interested in this rare disease field.
That must have been lovely though, to have that sense of community right from the beginning.
Yeah.
I think that's something that we kind of hear from a lot of patient advocates, is the importance of community and the role that can play in advocacy.
Exactly.
Have you felt that? Is that something that you think is really important to your work?
Yes, of course. Because, of course, alone you can only do that much.
Yeah.
But you have the whole community behind you. It's always easier.
Yeah. When you're together, the voice is that much louder.
Exactly. You amplify the voices.
And so once you'd started advocating for your rare disease, obviously it's not kind of something that you begin overnight. How did your journey begin? What was the kind of your first foray into the advocacy space? What did that look like?
I think I started really the patient advocacy during university. When I was involved in a project, we organized a workshop for academic staff, on rare diseases and disabilities and what it's like being in the academic field and having a disability and a rare disease. So I think that's how I started my patient advocacy journey. And then I moved to France, where I put everything in pause because I was finishing in my studies. But I was always telling myself that when I come back to the Czech Republic, I want to, do more and get more involved. So that's what I did after.
Amazing. Yeah. And are there any major milestones that you're really proud of? I mean, obviously your advocacy journey is still very, very young, very new. Are there any things that that really stand out moments for you?
I think it doesn't have to be something big.
Yeah.
It doesn't have to be huge, For me, it's, for example, when our community shares with us how their lives have been positively impacted by what we did, or that their quality of life have been, increased or get better by what we did, by the piece of advice we gave them, by the medical professional we recommended.
Yeah.
So that's, for me, that's that. Then, of course, there's this long-term project that we don't see immediate results of. But we are working on many long-term projects. And of course, it's not an easy task to change a system that is excluding rare disease community, and you cannot change it overnight. But we are moving forward, and that is the most important. So.
Yeah, I think that's often a really underestimated factor in rare disease advocacy, is the fact that these things, it's often really small incremental changes, and there's huge fanfare when you reach those big milestones, but they don't come very often. So how do you personally measure achievement and success in your advocacy journey? What are the things to you that are really important that maybe they aren't celebrated on kind of a national or a European level, but actually to you and your community, they really do mean the world?
Yeah. I think that would be what I mentioned before, when people come back to us and tell us that their quality of life, for me, it's really the quality of life that is the most crucial and that is very often forgotten. We often talk about, treatments, cure, but 95% of rare diseases don't have a cure, don't have, a treatment. So the quality of life can be improved by other, means.
In other ways.
Yeah. So it's really that, or when we manage, to find a medical professional that is educated on our rare diseases, so we know that we can send our members somewhere where they will be helped, So that is, I think, the small steps that count. Yeah.
They're really important and are often overlooked. So it's nice to give them a shout out.
Yes, exactly.
Definitely. So far we've covered some of the amazing moments of achievement and those really important successes that you've had during your career, but it's equally as important to shine a light on the challenges that you face. So what do you think have been some of the most challenging moments, or some of the the most challenging experiences you've had thus far as a rare disease advocate?
I think it's the lack of time, the lack of resources, and at the beginning, for example, when you are starting your own patient organization, it's building the community that you need, and so people can get to know you. I think that is the most challenging, but mostly I would say the lack of time and lack of resources, because I would like to mention that many times patient advocates, they don't do only patient advocacy. They may have another professional experience besides. So I think this is the most challenging.
Yeah. And as a young person, obviously it's a particularly unique point of view in terms of compared to maybe the more traditional rare disease advocacy space. So what do you think that young people, and specifically young women, can bring to the rare disease advocacy field?
Well, I think that women living with rare diseases, or women in general, we face quite unique challenges that other people might not maybe encounter, So, for example, in our community, so women living with rare diseases, it's mostly medical gaslighting. So women are not believed, their symptoms are dismissed, and this, delays the diagnostic even more. So I know many cases, myself included, if the medical professionals, if healthcare listened, the diagnostic odyssey journey would be much shorter in many times. So I think that's why women's voices are very important, because people, who went through these challenges, that can be quite traumatizing. They can relate to someone else who talks about it. So I think this is very important.
Yeah, hugely.
Yeah.
And I think often as well, there's a massive emphasis on, because obviously a lot of people are going through this diagnosis journey when they're very young, when they're children. But that transition into adulthood is sometimes something that is either neglected or is forgotten about, or people kind of really struggle with. So if you could give a piece of advice to healthcare professionals or other people in the rare disease space who want to best help people transition from childhood into adulthood and achieve the best quality of life, like we were discussing earlier, that they can, what would be your one piece of advice?
Well, to make the transition as easiest as possible, by having multidisciplinary teams in place, where people living with rare diseases, when they are transitioning from childhood to adulthood care, where they can come and they don't have to find every medical professional, one by one, which takes so much time, so much energy, and very often so much traveling that not many people can do, due to their conditions or other resources. So I would say I make this transition easier by putting everything in one place, in a reference center or a clinic where people can come and transition.
Yeah. I mean, even if it's not in one physical place, but it's in one digital place.
Exactly.
I mean, these days virtual networks can do so much.
Exactly.
But as long as that information is pooled somewhere, then someone has a new way of accessing it.
Now you make me think about, allowing more hybrid appointments for people living with rare diseases. So if it's possible, of course, not every medical exam can be done, online, but just consultations and appointments, if this can be done online, it's a huge help for people living with rare diseases.
And I think that's something that the pandemic in many ways really helped show the possibilities actually of the online medicine can offer people, and actually it's worth recognizing that those advantages don't stop at aren't unique to COVID-19. They, for people living with rare diseases, they really can go on for many years.
That's what I'm always saying, that what the COVID-19 pandemic has shown us was how really ableist we are as a society. Because before the pandemic, people with rare diseases and disabilities fought for ages for being able to have medical appointments from home, being able to study from home, being able to work from home. But all these accommodations, because these are accommodations, were denied to many. And then overnight, with the start of a pandemic, it was possible because the whole world needed them. And now, as we start returning back to normal, even though it's not over, they are being denied to many again.
Yeah.
So as you said, I think we just need to learn from this experience that everything was possible
Create a new norm.
create a new norm. Yes, exactly.
So we've already covered some of the amazing things that you've achieved in your career thus far, but I just want to ask, what would be some future goals you have for your advocacy work going forward? Maybe a project that you're really passionate about, or a specific issue that you really want to tackle?
Yeah, so I think it would be to ensure an early access to diagnosis, because the more you wait, the more those conditions do an irreversible damage to all areas of life. And we've been working on this. We would like to build a network of medical professionals where we can, send our members of our patient organizations where they can get help, diagnosis. So that would be one goal, more maybe long term. And also, to work on the social area of things. So everything that is disability assessment criteria that is very often problematic, and rare diseases, they just fall through the cracks, of the social system. So we have a project with the Ministry of Health of the Czech Republic. So I have a lot of hope in this project, and I hope that in a few years, we'll see some results. So I think that would be it for the future. Yeah.
Thank you so much for joining us today and for sharing your experiences. It's been a great conversation.
It's been a pleasure. Thank you.
You've been watching 10 Minutes with Adéla and me, your host, Rhiannon W. Thank you very much for watching, and remember to tune in next time.